I believe evidence-based medicine takes away from healing.
Today's episode of Don't Do That Medical Edition.
We get so lost in the facts
Yes, because facts matter.
that we stop looking at the person as an individual.
No, because facts are part of what makes someone an individual. A lot of people have this myth that doctors can't consider the person as a whole person, and that's exactly what it is, a myth. I'm intelligent enough to know that all the systems in your body interact, and what makes you part of that are facts.
I work with chronic illness and I have to think outside the box, and I'm not using therapies that are evidence-based.
In general, if your physician or other healthcare provider tells you they're not using therapies that are evidence-based, that's concerning unless you're in a clinical trial.
I use LDN off-label, and I also use peptide therapy, which is not very well researched yet for specific conditions. And I use a lot of therapies that most people would be like, what the fuck is that?
Using stuff off-label is actually very common. However, just because it's off-label doesn't mean it's not evidence-based. In general, I don't recommend experimenting with patients unless you're in some sort of IRB-approved research study for which you should undergo a consent for.
You're not going to do something, you're not going to think outside the box because there's no evidence to do so. You are losing patients and you are not providing them the help that they deserve.
I don't think it's a fair statement to say just because a physician is not experimenting with their patients and their healthcare that they're not giving them the healthcare they deserve. Now, sometimes you do have to think outside of the box, and absolutely, sometimes we do. We have patients that don't fit the textbook, but we take the best evidence-based approach to those patients that we can. And as a disclaimer, don't try and contact this person, harass them, or anything like that. Be kind.